Welcome back. This is Class 3, Nursing section of On the Road to Diabetes Health. This is Staying Healthy with Diabetes. Our outline for today: we'll discuss our action plans, knowing our numbers, not just our blood sugar, and we'll review potential long-term complications. Conversation maps will not be used in our online course. So let's review our action plans. How did it go? Were you successful? What were the challenges you faced? Were there barriers to achieving what you'd set out to accomplish? If so, what were they? Did you brainstorm solutions or other ideas to try? Consider revising your action plan and keep working at it. Also, consider ways you can reward yourself for your successes that won't sabotage your end goal. Know your numbers. A, A1C. B, blood pressure. C, cholesterol. And K, kidney function. Please refer to your Staying Healthy reminders on page 46. Hemoglobin A1C, discussed on page 7 in your On the Road booklet. As a reminder, glucose is another name for sugar. Hemoglobin is a part of our red blood cells. It carries oxygen to our cells and tissues, and glucose sticks to it. When you have your blood work done at the lab, they analyze your red blood cell to see how much sugar is stuck to the hemoglobin. The result reflects our overall average blood sugar level over the previous 3-month period of time. The A1C is measured in a percentage. This is different than your glucometer. Your glucometer measures your real-time blood sugar level in millimoles at the specific time you test. The conversion chart is listed on page 7. A target A1C of 7% or less is equivalent to an average blood glucose of 8.6 or less. Blood pressure, page 25. Blood pressure refers to the pressure in our blood vessels. The top number is the pressure when the heart pumps. The bottom number is the pressure when the heart rests. High blood pressure damages blood vessels and can speed up complications of diabetes. You should check your blood pressure at the doctor, diabetes center, at home, or the local pharmacy. Ideally, blood pressure should be less than 130/80, but greater than 90/50. If your blood pressure is not in target, discuss this with your doctor. Cholesterol, also referred to as lipids. This is a fatty substance that resembles wax. It can stick to the blood vessel walls. If it builds up, it can narrow the blood vessels. This increases the risk for blood clots and restricting blood flow, as well as overall risk for diabetes complications. Diabetes is associated with a high risk for vascular and heart disease. LDL is considered our lousy cholesterol, L for lousy. It is found in foods that come from animals. Our HDL is considered our healthy cholesterol, H for healthy. It helps to reduce the amount of lousy cholesterol we have. Refer to the Staying Healthy reminders on page 46 for your target levels. Do not smoke. Page 38. Quitting smoking is one of the best ways to lower your risk of complications. It is also very hard to do. There are many resources that can help. If you're ready to quit, visit www.quitnow.ca or discuss with your doctor or diabetes team. Diabetes can cause many complications, such as strokes, heart disease, kidney failure, eye damage, nerve damage, and poor circulation. We'll start by discussing what a stroke is. Increased cholesterol causing narrowed blood vessels, as well as damage to arteries from high blood pressure or high blood sugar, can lead to a stroke. It is caused by a blood clot or blood vessel rupture in your brain. This prevents oxygen from reaching the area beyond the clot. The effects of a stroke depend on the part of the brain that was damaged and the amount of damage done. Symptoms are typically severe headache, facial drooping, numbness on one side of the body, and inability to raise both arms or slurred speech. If you experience any of these symptoms, it's important to call 911 as soon as possible. What is a heart attack? A heart attack occurs if a blood vessel in the heart becomes blocked, affecting the heart's ability to pump. Men and women can experience different symptoms. They can be mild or intense. They can include chest discomfort, pressure, squeezing, fullness or pain, burning or heaviness, sweating, upper body discomfort including neck, jaw, shoulder, arms, or back, nausea, vomiting, or heartburn, a shortness of breath, or lightheadedness. If you think you are having a heart attack, call 911, stop all activity, take aspirin, either one 325 milligram tab or two 81 milligram tabs, rest, and wait for help to arrive. Kidney damage or nephropathy. Our kidneys filter or clean our blood, removing waste products and keeping usable products. If the filters don't work properly, protein can be detected in a urine test known as the albumin-creatinine ratio. The eGFR is a blood test that indicates how fast your kidneys filter. If it's too slow, waste or fluid can build up in your body. You may notice swelling in your legs or ankles if you are retaining excess fluid. Sometimes blood pressure medications are prescribed to help protect your kidneys when you have diabetes, even if you don't have high blood pressure. Check your kidney function at the lab once a year. Refer to the Staying Healthy reminders for your targets for both the ACR and eGFR tests. Eye damage or retinopathy. The retina is a tissue lining the back of the eye. Like the kidneys, the delicate vessels in the eye can be damaged by high blood sugar or high blood pressure. This can cause bleeding, which is the leading cause of blindness. Eye screening is important for early detection of disease. A dilated eye exam should be done by an ophthalmologist yearly. Nerve damage or neuropathy. Our nerves communicate to every cell. Damage can occur anywhere in the body. Managing blood glucose levels is an important preventative measure. Autonomic nerves manage our digestion, sweat glands, heart, bowels and bladder, as well as sexual functions. Peripheral nerves affect our hands and feet, influencing our sensation to hot, cold, numbness, tingling, or pain. How feet can be affected by diabetes, page 40 to 42. Diabetes is the leading cause of foot and leg amputations in Canada. Feet that have higher risk of problems include those with nerve damage, blood vessel damage, foot deformity, and corns or calluses. The body depends on our nerves to send signals to the brain informing us about temperature, pressure, or pain. It tells us if the water is too hot, our shoes are too tight, or if we've stepped on a sharp object. Circulation affects the body's ability to deliver oxygen or fight infection. High blood sugar can damage these systems, putting us at high risk of problems. Symptoms of foot nerve damage include a loss of feeling, numbness, burning, pain, tingling, or trouble with balance. The symptoms are sometimes worse at night and are often difficult to treat. It's important to manage blood sugar, stop smoking, and reduce alcohol. Screening for damage. A microfilament tool is used to test the sensation in your feet. This can be performed by your doctor, podiatrist, foot care nurse, or diabetes nurse. Symptoms of blood vessel circulation damage include cold feet, leg or calf pain when walking, at night, or at rest, changes in skin color, either dusky, bluish, or white, sores that don't heal quickly, or dry cracked skin, especially to your heels. Self-management tips for healthy feet. 1. Prevention. 2. Early detection. And 3. Prompt treatment. Foot care. Page 40. See a foot doctor if you cannot take care of your feet. Ensure you wash daily and dry well, especially between the toes. Avoid extreme cold and heat. Be very cautious with heating pads or hot water bottles. If you have decreased sensation, you may not be able to tell if the water is too hot. Hot water or hot pavement can cause extreme burns. Apply moisturizer to dry areas, but avoid between the toes. Too much moisture can lead to fungal infections or athlete's foot. Moisturizers containing allantoin or urea help with extreme dry feet or cracks. Cut nails straight across to avoid ingrown toenail. Always file sharp edges with an emery board. You can soften nails in warm water prior to cutting them if they're thick or difficult to cut. If you have any difficulties seeing or reaching your feet, seek assistance from a foot nurse or specialist. Do not self-treat corns or warts, as this can cause injury and increase potential for infection. Protect your feet by wearing supportive slippers and socks that aren't slippery. Wear seamless socks without tight bands that may constrict blood flow and cause swelling. Compression stockings are acceptable. Ensure you check your footwear for debris that can cause issues. Early detection is very important. Pain is usually our primary defense, letting us know there is a problem. However, if we have neuropathy, this defense is not reliable. We must visually check our feet every day. Look for signs of corns, calluses, blisters, or scrapes, or signs of infection such as redness, swelling, heat, or discharge. Prompt treatment is required for any issue. See your doctor for uninfected sores that don't improve in 2 to 3 days. If any signs of infection are present, seek medical attention immediately. Infection can raise blood sugar and in turn cause the infection to become worse. Severe infections and amputations can be a result of minor injuries or problems left unattended. Always follow the treatment plan your doctor gives you. So to summarize, managing our A1C, blood pressure, and cholesterol numbers to target is important in preventing diabetes-related complications. The tools we use to achieve these targets are all of those we've discussed over the last 3 weeks. Healthy eating, managing stress, regular physical activity, medications for blood sugar, blood pressure, and cholesterol, a regular blood sugar and lab tests, and regular screening exams. You are welcome to follow up with the Diabetes Health Center as needed and available. Diabetes website. For the most current and up-to-date website, please visit Diabetes Canada at www.diabetes.ca. Thank you. I hope you've enjoyed our presentations, and we hope to see you at the Diabetes Center. Take care.